My name is Ahmed Saad Khoshhal, coming from Taiba University of Medina Munawwara. In a couple of seconds, inshallah, we will start presenting a number of research with a different interesting topics distributed from a number of universities around Saudi Arabia. I want all the presenters to stick firmly to this, please, and pay attention that they have 10 minutes for speaking and to present their presentations, and 5 minutes for questions. Last but not least, any one of the audience are more than welcome to ask any question after the presenter finishes his presentation. And starting from the first topic, which is an unusual swelling in the soft palate, diagnosis challenge by Mr. Mut'ab Al-Mtairi from Al-Farabi College of Dentistry and Nursing. Please welcome Mr. Mut'ab.
Bismillah. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Mut'ab Al-Mtairi from Al-Farabi College. I'm very glad to be with you today to present my research, which is unusual swelling in the soft palate, which is case scenario. This research is done by me, Mut'ab Al-Mtairi, and Muhammad Asiri, and our Dr. Umar Kojan. Clinical history. Our patient, female, aged 69 years old, has a rubbery mass located in the soft palate. Chief complaint. Her main chief complaint was difficulty in swallowing, and the lesion started before 1 year ago, and it's painless. This is the clinical picture of the lesion. It was located in the right side of the soft palate and exactly posterior to the maxillary tuberosity. And this is an excisional biopsy. It was 4.5 centimeter. And this is the photomicrograph, shows the endothelial cells arranged in cluster. And this is the high magnification. It shows abnormal mitosis with large cells that resemble the epithelial cells. And this is another biopsy, shows some vacuoles. To confirm our diagnosis, we made some tests, which is CD31 and CD34 and CK and EMA, and it was positive. On the other hand, we made some tests, which is HIS100 protein and HMB45, and it was negative. And this is the photomicrograph, show the positive of okay. And this is the photomicrograph, shows the positive of endothelial presence, the CD34, which is the marker of endothelial cells. And this is too the CD31, which is marker for endothelial, and show is positive. The diagnosis is epithelioid hemangioendothelioma. Epithelioid hemangioendothelioma, it's an intermediate malignant vascular tumor, which was described firstly by Enzeniger and Weiss in 1982. The common location include soft tissue, lung, liver, bone, and skin, represent a distinct entity with an unpredictable clinical course. It's affecting middle age in both sexes. 10% within derms, enlarging mass usually with pain, most over 5 centimeter, 10% with multifocal disease, with indolent course surviving for decades. Clinically, oral EHE have appeared as pinkish swellings, mainly on the gingiva, which sometimes ulcerated with size 2 to 15 millimeter. The cells generally had a rounded epithelioid character, regular nuclei, and relatively ephematotic figure. Occasional features include spindle cells and scattered enlarged. Some of the cells show prominent cytoplasmic vacuoles. The vacuoles are methane negative. Immunohistochemically, Menzel in 1997 positive for at least one endothelial marker, which is CD31 or CD34 or factor 8 or Ulex Europs, or cytokeratin positive, alpha smooth muscles, actin positive or negative. Differential diagnosis: primary or metastatic carcinoma, epithelioid sarcoma, myxoid liposarcoma, and myxoid chondrosarcoma. Treatment: it responds only to the surgery. The prognosis good, poor, survival 2 to 94 months. Conclusion: characteristic morphological features together with appropriate immunohistochemical staining helps in establishing the diagnosis. And thank you.
Thank you so much. Thank you so much, Mr. Meteb. Now we're going to question. Are there any questions from the audience? They are more than welcome to ask.
Thank you for your presentation.
You're welcome.
But you didn't mention about the medical history of the patient.
The
Medical history of the patient.
Yeah, I mentioned that the medical history. Yes, he does not have any medical history, any diseases. Only the epithelioid hemangioendothelioma.
No systemic disease, no drugs.
No.
Thank you.
Are there any other questions?
Yes, can you tell us, you didn't tell us quite enough about how did you go about diagnosing the case, making sure it was not like hemorrhagic before you went for excisional biopsy. You just went from the clinical features and consistency to excisional biopsy. So what happened in between? How did you make sure before you go and excise and do for surgery and remove the whole mass, make sure that this is not a vascular mass?
Because the disease has not clear course, and our pathologist decided to take biopsy because he thought that is cancer.
Thank you.
Any question?
Did you make any medical investigation before taking the biopsy?
I think he did some blood test.
Blood test. Okay, thank you.
Any other question from the?
Huh?
No questions? Thank you again, Mr. Mut'ab. Thank you for sticking on the time.